Almost 20 years ago, I started working with UCSD School of Medicine, the San Ysidro Health Center, and one of the Scripps community hospitals, along with the San Diego Border Area Health Education Center, to develop a community-based family medicine residency training program. And right from the beginning, our goal was to train family physicians that had a passion for service in the community, and particularly in underserved settings. There were pockets of the community that really had a shortage of primary care physicians, and particularly family physicians. And by linking this family medicine residency program with a community health center, we were able to do two things at once. One was actually increase access to care immediately, and then sustain that by graduating family physicians that would stay in the community.
The model that she envisioned for reaching the underserved community was to integrate throughout the 3 years of residency curriculum opportunities to have the residents training in underserved areas. So we began with the clinic that served the population, but then she really envisioned the residents having community experiences outside of the walls of the clinic. And that means that she was always the first one to be present for these community events. So that would be Saturday health fairs, a massive screening of youth in preparation for sports participation, diabetes fairs, breast cancer screening events. So Marianne would be present and the residents would sign up, and in this fashion she provided a role model and a leadership that very quietly conveyed the importance of engaging your community.
On a day-to-day basis, the residents themselves, with faculty supervision, are providing comprehensive primary care in a continuity setting. Although our initial and our closest collaborator is the San Ysidro Health Center, we also work with some of the smaller community clinics and provide women's health services. We provide prenatal care. And then on a monthly basis, the family medicine residents see over 1,000 patient visits.
Marianne has successfully partnered with multiple agencies in our community and written several grants to allow a successful high school-based clinic and mentoring project to continue. It offers opportunity for residents to work with adolescents. Many of the youth are pursuing health careers, and they reflect the underrepresented and underserved community that really needs the graduates to return.
It's actually been exciting to see that the program has taken off. It's really grown. Now we train 24 family physicians at a time. 8 graduate each year. We've graduated about 65 residents, and over 75% of them are providing care in San Diego County, primarily in areas of unmet need. These are really accomplished students who then have chosen not only to become family physicians, but to dedicate themselves to that kind of practice. And there are lots of other pathways that are open in medicine, and many of them, much more lucrative. So I think it really takes a particular level of dedication to choose this path, and it's really been remarkable, the students that we see.
Marianne McKennett is a friend, she's a colleague, and will provide support in the clinic, cover a shift, stand in for a call. And then she's a program director that does everything. She's a full spectrum family physician, delivers babies, provides medical services in the clinics, in the community, in the hospital, and administratively has a huge task to keep all of the quality of the curriculum and the training in line with the residency ACGME guidelines. She's a visionary. She keeps that big picture vision that inspires us all to do the best that we can to provide the care and the education to the future workforce of our community.